Hi everyone, welcome back, and thank you for the music and the yoga. I just finished my finals week, so it was definitely appreciated. I have the honor of introducing our last keynote speaker of the day. Just a reminder, please use one admin questions to ask questions throughout the session. So Dr. Tamarra James-Todd is the Mark and Catherine Winkler Assistant Professor of Environmental, Reproductive, and Perinatal Epidemiology in the Departments of Environmental Health and Epidemiology at Harvard T.H. Chan School of Public Health. She is also an instructor in medicine at Harvard Medical School and an epidemiologist at Brigham Women's Hospital. Dr. James-Todd evaluates the link between environmental chemical exposure and diabetes, obesity, and related cardiovascular disease risk among women during the perinatal period and beyond. She is particularly interested in environmental endocrine disrupting chemical exposures, including exposure to phthalates, phenols, and per- and polyfluoroalkyl substances during the sensitive window of pregnancy as it relates to long-term adverse cardiometabolic outcomes in women. She is also interested in racial ethnic disparities in environmental exposures as it relates to both pregnancy and cardiovascular disease outcomes. Dr. James-Todd is the principal investigator of the NIEHS-funded ERGO study, an ongoing prospective cohort study examining the role of environmental factors on pregnancy and postpartum health. Dr. James-Todd received her BS in molecular biology from Vanderbilt University, MPH in international health from Boston University, and PhD in epidemiology from Columbia University. Today, she'll be discussing personal care products and Black women's health. Dr. James-Todd, welcome.
Thank you, Marissa, and thank you so much for the invitation to speak and present to you guys today. I don't know if people can see my screen. I hope so. Yeah, okay, thanks, Marissa. Okay, so it's a pleasure to be here with you all, and I'm gonna just jump right in. It's hard to follow amazing yoga and music, so here we go. I hope to leave you all with some thoughts and some knowledge around what is in the products that we use. And I will be talking more about these chemicals that we often have some knowledge or awareness of, but may not in the context of endocrine disrupting chemicals. And I'll specifically be highlighting 3 periods across the life course of women, focusing on puberty, pregnancy health, and then chronic disease or menopausal status, and some strategies that we can use to reduce our exposures to these chemicals. But first, I want you all to know that chemicals that are placed in our products are everywhere. We're exposed to hundreds of chemicals on a daily basis, ranging from things that are used in our foods, and things that are used in our homes, such as pesticides, to things that we place on our bodies or ingest, such as these phenolic chemicals that people are probably most familiar with, bisphenol A, BPA, but certainly there's been replacements of that. So whenever you see BPA free, it just means that they've replaced it with BPS or BPF. Surfactants, which perhaps you've heard a lot about, and even there was a recent movie about this class of chemicals. They're commonly used in not for non-stick surfaces, including food packaging, as well as raincoats and other things. Flame retardants, which are even in the computers that we're sitting with right now on our cell phones, and so on. But today I'm going to be talking a fair amount about chemicals that are known as plasticizers. And these are used in a lot of our personal care products, including hair products, which I'm going to speak about a bit more at length today. So all of those chemical classes that I just mentioned to you all fall into this category of being endocrine disruptors or endocrine disrupting chemicals. So you'll see this term EDCs throughout. And what that means is that they are substances that are either made by man or can be used and produced from natural products that have the ability to alter our body's normal endocrine system. And the endocrine system is responsible for many processes in our bodies, ranging from hormonal processes, reproductive health, even neurological health. And the fact is that it doesn't only impact us, but it can also impact future generations, depending on the time period in which we are exposed. In the context of women's health, which is what I study, endocrine disrupting chemicals have been associated with infertility or subfertility. So Black women are actually twice as likely to experience infertility and subfertility. They also impact preterm birth risk. It increases preterm birth risk as well as pregnancy hyperglycemia. And so hyperglycemia is basically elevated glucose levels, endometriosis, and fibroids, which, as we know, Black women have a much higher prevalence of fibroids. Adipogenesis and obesity simply means that the ability for our body to actually increase fat tissue. So the more fat tissue, basically, because we're exposed to these chemicals. In fact, some of these chemicals are considered to be obesogens. If you ever hear that word, it contributes to obesity. As well as premature breast development, thyroid disease, and diabetes, and other related conditions. So a few years back, I actually took a picture of one of the bottles of hair products that was sitting in my cabinet. At the time, I don't think it was something that I was readily using, but I want you to note, and hopefully if you're not at home, maybe you'll be home soon, take a look at the back of your bottle. It has probably bottles. They probably have a whole lot of different types of chemicals. I've circled in purple these chemicals, parabens, propyl and methylparaben are in here. And these are these phenolic chemicals, or the phenols that I mentioned to you guys earlier. Fragrance is also commonly used in products. And note, this is typically just standardly marked on the products, but that typically is made up of hundreds of chemicals, and it is synonymous oftentimes with phthalates, which are those plasticizers I mentioned earlier. That's what's holding the fragrance in. Otherwise, it would just evaporate from the product. So there's these solvents that are used to be able to hold it in the product. So even in this, there's multiple types of endocrine disrupting chemicals. So I mentioned phthalates, and again, that's synonymous with fragrance, and they're found also in perfume, as well as medication. So this is vitamin E. It's anything that's kind of like a time release, typically has plastic around it. Medical tubing devices and such. If you use fragrances in your home, up until recently, they were also found in children's toys, food packaging, and in cosmetics. So most of the U.S. Population has detectable levels of these chemicals, and they are used, as I mentioned, as plasticizers, solvents, and lubricants, and they can be ingested, inhaled, and absorbed into the skin. So what's really important to note, and the reason why I'm particularly interested in Black women's health, is because women have higher exposure to these chemicals than men do. So please note that this is only 1/10 of the exposure, with data coming from a U.S. representative population that is collected on a yearly basis from the Centers of Disease Control and Prevention, known as NHANES. And so we're most exposed to diethyl phthalates. This is the metabolite of it, which is what we think is actually the harmful or active compound. And we also note that very high concentrations of this other chemical here for women compared to men. So red is women, blue is men. And these are the chemicals that are commonly found in personal care products. And in fact, the average woman uses about 12 different products a day, is exposed to close to 200 chemicals per day, compared to the average man, who's about roughly half of that. Of note is that in addition to women having higher exposure levels, Black women and Hispanic women also have significantly higher exposures to those same personal care product chemicals. So it's really important to note that this is potentially a problem when you're thinking about what are the health implications. So I mentioned to you that timing may matter. Timing matters with respect to exposure and with respect to what the health outcome you may expect to see. So I'm going to first give you this example of childhood hair product use in early puberty in Black girls. And just as a start for this, I really became interested in this after reading a small study that was conducted in young children ranging from 4 months old to 4 years old. It was actually a case series written by a pediatric endocrinologist. And he found that these young children had breast and pubic hair, and they were all African American. And upon further evaluation, he noted that they were all using hair products that, it turns out, are still commonly used today. And of key importance to that, it turned out that all of these hair products contained different forms of estrogen. So estrogen was actually being put into the products. The product labels did not state this. The moms or parents were using this on their children. They were little girls. And so when they stopped using these products, the pubic hair fell out and the breast regressed. And it was also around this time that this Time magazine issue hit the stands, really trying to figure out why are we seeing earlier and earlier onset of puberty in young girls, which is a risk factor for breast cancer. This was also following a publication of a very large pediatric study where they also showed that age at when a girl starts her period, also known as age at menarche, was much earlier for Black girls compared to white girls, with over 60% of Black girls having started their periods by age 12 compared to 35% of white girls. So with this, we decided to launch the Greater New York Hair Product Study. And this was a study where we wanted to understand hair product usage patterns. So we recruited over 350 women in the New York City greater metropolitan area. And this study was done some time ago, but it was one of the first studies to really inform us of product usage patterns by race, ethnicity, as well as to test and identify what chemicals were in commonly used Black hair care products. Prior to this, very little had been known or done. And so these were some of the example categories that women from qualitative and quantitative research shared with us as far as what they used. And so what you'll note, which was not surprising to me as a Black woman, is that hair oil use and a number of other hair product use was forever use was much higher in the African American, African Caribbean, and Hispanic population. In fact, these numbers are statistically significant, just about for everything here, compared to non-Hispanic white women in this study. We also looked at label information. So if the products contain parabens or placenta, and we found that for labels, and again, as I mentioned to you, I showed you the label earlier, it's not always, like phthalates, for example, are not referenced in the label. So just note that. But among the information that is on the label, almost 50% of African Americans were using products that contained parabens or placenta, compared to only 7% of non-Hispanic white women. So again, potential issue with respect to exposure. It's also worth noting that when we looked at early onset of puberty, that you'll see here that hair oils seem to be the driver, as did perms and relaxers, with about a 60% increased risk of starting your period prior to age 12 if you ever used hair oils or perms. Now, the interesting part is that the longer use of hair oils, not perms, but the longer use of hair oils was also associated, as well as frequency, was also associated with even stronger associations for earlier onset of puberty. And if you think about it, one of the key things is that many of the hair oils that Black women commonly use are very heavily fragranced. So that is something to note. We also looked at this in another study population and found a twofold increased risk for starting your period before age 11. And further confirming that hair oil use, again, was something that might be particularly problematic. So we partnered with Silent Spring Institute, and we provided them with a list of the most commonly used hair products from that study. And what came of that was a study that came out that received pretty wide press around the fact that every single one of those commonly used hair products contained endocrine disrupting chemicals. And these were some of the classes of chemicals that were found, including that, as I mentioned to you all, parabens and phthalates, but many others that, in fact, in the environmental health and epidemiology world, we have fewer studies that are done in this. And it's, I think, particularly important when we're thinking about health disparities. The other thing to note, as you saw again on the back of that label that I shared with you earlier, is that there are many chemicals. And so how those chemicals operate together is really important to consider. So, you know, as a mixture, what happens? Are they able to bind to the estrogen receptor or the progesterone receptor. Again, these are endocrine disrupting chemicals. They impact hormones. And indeed, what was interesting was that many of the products, in fact, were, for example, pink oil moisturizer. For those of you, I'm probably dating myself. This was something that I definitely used in my preteen and childhood years. And it was, in fact, able to bind both to the estrogen and progesterone receptors, which is problematic that we have a consumer product that's commonly used that was able to bind to these. But what about kind of taking a step into the next life stage, pregnancy health? And so just to note, Black women, as I said earlier, are twice as likely to experience infertility. They're 50% more likely to deliver preterm infant. They're also 75% higher prevalence of preeclampsia, and more likely, even though their prevalence of gestational diabetes is the same as non-Hispanic white women, they're more likely to progress onto type 2 diabetes following a pregnancy that was complicated by gestational diabetes. And so, no, we have looked at personal care products, again, as a source of these chemical exposures by race, ethnicity. And this is data from 611 pregnant women. And I just want to bring your attention to the boxed categories where you can see that perfume use and nail polish use are much higher among Black and Hispanic women, whereas cosmetic use is much higher among white women. The important part of that is that when you're actually looking at what gets into your body, it looks as if these chemicals, phthalates, as I mentioned to you before, they're not the only ones, of course, are higher in pregnancy across all time points in pregnancy for non-Hispanic Black and Hispanic women compared to white women. So white women, non-Hispanic white women, this bottom line is pretty consistently low compared to non-Hispanic Black women here and Hispanic women. There's something interestingly happening here in mid-pregnancy, which also suggests that we can do something about this. Like we can actually modify our exposure levels. And so the important point to note is that there are some implications for this. So when we look at pregnancy, we find that higher phthalate exposure is associated with a variety of outcomes that are responsible for infertility, as well as pregnancy loss. So a threefold increase in pregnancy loss if you have higher phthalate exposure. They're also associated with a twofold increase risk of preterm birth and having a lower birth weight baby. Again, conditions that more commonly affect Black women. A 50% to a twofold increased risk of preeclampsia if you have higher phthalate and higher phenol concentrations. And finally, something we study in our lab a fair amount, higher phthalate exposure and phenol exposure is associated with higher glucose levels, as well as gestational diabetes risk and excessive gestational weight gain. One of the interesting things that we've embarked in with the ongoing study that I'm doing is looking at a source of exposure, specifically hair products. And what we found so far is when we asked women in our study about hair product use and including hair oil use, again, remember that hair oils were implicated as something that may be particularly problematic. What we found is that use of hair products later in pregnancy, this is occurring around 30 plus weeks gestation, daily use particularly, is associated with a 10-day earlier delivery. And this is actually, in the world of obstetrics, this is significant. This is not a trivial issue. And so might hair oil use, particularly in later pregnancy, be something that we should be looking at. This is kind of fresh off the press data still, so we'll be looking more at this in detail. Finally, with respect to later life and chronic disease and thinking about personal care product use, some data that also comes from that data set that I shared with you all earlier. That's a U.S. representative population, the NHANES study. We looked at phthalate exposure as it relates to diabetes, and we found that women who had the highest exposure, this darkest blue bar over here, had a twofold increased odds of diabetes. And this also translated to among women who didn't have diabetes. If we looked at their glucose levels, their insulin resistance levels, they also had elevated risk of developing diabetes in the future. So a potential problem. We also found a fourfold increased risk of metabolic syndrome, which is associated with cardiovascular disease. It's particularly among premenopausal women, so having this earlier. more weight gain if they had higher phthalate exposure, as well as earlier onset of menopause has been reported. So this is data. The first point, the metabolic syndrome, is from work that we've done in our lab. The other points are from Nurses Health Study, as well as other studies using that representative population of US women. So our goal in our lab is to really understand how can we reduce risk. We really want to go from thinking about, groups that have really a lot of risk factors, including using more personal care products that contain these chemicals, to really figuring out ways to reduce this through interventions. And so how can we do that? And I would say we need to read labels, but that's not enough, right? I already mentioned that. And for what it's worth, we can avoid trying to use, go fragrance free, avoid using products that contain parabens or formaldehyde releasing agents, as well as toluene. Try to shop organic or natural, and then consider making our own products and being in spaces and places when we do go to get our hair done or nails done, that we're in a well ventilated space. And I can't stress the need for advocacy around this work. Like California is doing an amazing job. Many other states are not. And so how can we do a better job nationally around these issues? Because it turns out that, and again, this is data from one of our students in our group, that availability is an issue too. So safer products are not necessarily equitably distributed. This is data showing that this is a lower income community that is predominantly Hispanic. And looking at this risk score that comes from Environmental Working Group, the hair products, which is represented most in this green bar, much higher risk score, have many, many more chemicals that are known to be toxic chemicals compared to say Whole Foods or Full Lane, which is an online, very expensive or higher end product line. There are technology devices that we can use these days to also inform us, including Environmental Working Group's Skin Deep app, as well as others. And I would be remiss to not mention this, because oftentimes people make synonymous the idea of natural, and I think we still don't know what natural really means. It could potentially be a marketing ploy, but the other issue is that many of the essential oils that folks use, including lavender and even tea tree oil, also have endocrine disrupting chemical properties. So we have to be really careful about not, going from the frying pan into the fire around some of these things. I'd like to thank my research team. This is an old picture of them. And so I will definitely take any questions now.
Thank you so much, Dr. James-Todd, for that great presentation. Does anyone have any questions? Feel free to send me a message and I'll read it out loud. But I already have a list of questions, because I always do, and I'm happy to start with one. One thing, I'll turn my video on. One thing that has come up a lot is that it would be great to purchase more natural products, but they're unfortunately more expensive. How do you suggest making safer products more accessible?
This is where I think advocacy matters, honestly. A few years back, I should say more like 10 years ago, we actually approached a large organization to ask if they would be willing to start producing safer products for Black women. And the response that we received at that time, and I think that this is still an issue, is that there's not a market for this, which is completely not true. And so I think the more that we advocate for this and show that this is something that there's economic value to, the more likely and the greater ability we will have to purchase safer products at a price point that is more reasonable.
Thank you for that. We do have one question. How do we share this health information with our communities, family, and friends? For example, the information about health risks for nail polish, talc powder, shampoo, hair oils, and makeup. Is there a cheat sheet or an infographic that we can share with them?
I think that Environmental Working Group and Silent Spring Institute have done a phenomenal job. There are also organizations all across the country, Black Women for Wellness, and others that are really trying to provide information to the community and to translate that from kind of scientific journals where that lives. We're also trying to do that in our lab, and but I would encourage you to really, the Skin Deep website is a fantastic website.
Thank you. We have 3 minutes left, so again, feel free if anyone else has some remaining questions. Dee Dee shared a link to Environmental Working Group and Black Women for Wellness's publications in the chat, so also feel free to check those out. One other question that I think a lot of us might have is in terms of hair oils, what really is it about them? Or is there like a specific chemical that keeps coming up when you're doing your research?
I mean, I really do think that fragrance issue is a problem. You know, as women, I think that we like to smell good. I mean, I remember as a teenager going to Bath and Body Works with my friends, and that somehow signifies beauty. And for many of the hair oils, you know, they are very heavily fragranced products. And I don't know if we would be willing to buy an unfragranced hair oil, you know, but it's something I think worth consideration. I don't think that's the only thing. I think it is, as I showed, the mixture of these is problematic. So how these operate together, they're kind of being greater than the sum of the parts, could be really problematic. And so maybe too, there's a lot in the hair oils, and the fact of how we use them. Oftentimes we place those more readily on our scalp, but be assured, even when we just put it on our hair, I've heard somebody say to me, "Oh, but I'm not putting it on my scalp, I'm putting it on my hair." And I'm like, but your hair sits on your scalp. And so the scalp is an incredibly porous organ, as far as like the part of the body that it sits on, it is. And so I think that is something that we need to take into consideration.
Great. Thank you so much. I think that's it for us. Thank you so much again, Dr. James-Todd, for your important work that you're doing and presenting with us today.